This essay starts out with my latest visit to Dr. Chen, who is my internist and takes care of me. And he did a Medicare annual physical checkup on me to make sure that I was going to be around for a while. And there were two blood tests that he wanted to take. One was a blood panel, normal blood panel. And the other one was a PSA test. I had prostate cancer. Had an operation 12 years ago. And it had gotten outside the prostate and came back within a couple of years and went through radiation and all that. And I have to now get a blood test every year to check and see whether the cancer is still gone. And this, I think, was the ninth year that I was cancer-free from pancreatic cancer. And then Dr. Chen says, is there anything else you need while we're here? And I said, I'd really love to get a blood test to discover whether I have any antibodies for COVID-19. And he said, you can have it today. I got the blood panel back, perfect. I got my PSA back, perfect, it was negative. But the one that came back with the antibody results was also negative. That was the first time I can remember of ever wanting to have had a disease. And interestingly, because I've done the dance with death a couple times and worried about the coronavirus, it sensitizes me to other people who might not be as fortunate as I was. And therefore, I wanted to give my blood, let them give plasma to somebody that was in ICU and save their lives. And I couldn't. But we need to, each one of us needs to think about how we can help other people because other people have helped us. And that is one of the blessings of the coronavirus. Another blessing of the coronavirus has to do with air pollution and global warming. And there are a number of photographs in this essay to prove how the coronavirus has in many ways slowed down the pollution of the atmosphere because fossil fuels, car emissions, factory emissions have been greatly curtailed. And finally, the coronavirus has taught us something about universal health care. Health care, there's a big debate about it in America, about health care being, is that a right or is it a privilege? And I've written about this many times before. In the late 60s, I went to University of Edinburgh in Scotland, and I signed up for my classes, and the next thing I had to do was to go to see a doctor because of national health. A half a century ago, Great Britain had universal health care. Not just for the Britons, the people who live on the island but for anybody, students from another country, anybody who just happens to be there, because they consider that a right. And there's kind of a strange juxtaposition. There are a lot of people in America talking about universal health care and we can't afford it, you can't do it, Universal health care not only protects those who don't have the money for health care, but it also protects those who have the money for health care. Because you can get the coronavirus regardless of your income level. And if you help people who are having problems with financing health care insurance and being covered and going to see the doctor, if you can help them by covering their insurance with universal health care, you are also helping yourself and other people that have money. They can have insurance. We're facing a major catastrophe in our country. And what we need to do is to think outside the box. So I appreciate your time watching and listening to this video and reading this essay. In the meantime, you take care.